Hi, my group is made up Luz Martínez, Juliana Niso, Camila Sánchez, María José Garrido Leca, Valeria Torres, and me, Diana Cortez. Well, our project is titled Sensitivity of Cystatin C versus commonly used biomarkers for early detection of kidney damage in people with type 2 diabetes mellitus in Colombia. First of all, diabetes affects people's functional capacities and quality of life, leading to significant morbidity and premature mortality. The prevalence has increased substantially, and in this sense, according to the World Health Organization, 463 million adults have this disease. Also, in Latin America, 62 million people live with type 2 diabetes mellitus. And in the Colombian context, 3 out of every 100 people have diabetes mellitus. On the other hand, one of the best known consequences of this chronic disease is kidney damage and terminal renal disease caused by diabetic nephropathy, and its prevalence is approximately 30 to 50%.
Thus, the use of biomarkers has the function to distinguish between early or late renal damage, allowing a timely diagnosis and management before the appearance of signs or symptoms of renal failure. However, commonly used biomarkers have several disadvantages, such as the diagnostic sensitivity of serum creatine concentration to identify early stage of renal dysfunction, as its concentration increase once the GFR is affected more than 50% and change with age, diet, sex, and muscle mass.
As stated in the referential framework, there is a need to investigate the ability of the biomarker that facilitate early detection of acute kidney injury and interallowed risk stratification, allowed with monitoring of response to treatment. However, the advance of a precise, accurate, and not invasive endogenous market of GFR remains a limiting factor. Therefore, the aim of this study is to determine the sensitivity of the use of the cystatin C in comparison with the other biomarkers used for the early detection of renal damage in people diagnosed with type 2 diabetes mellitus.
According to this, low molecular weight proteins like beta-2 microglobulin, beta-trans alpha-1 microglobulin, and retinol transporter protein have been proposed to determine glomerular filtration. However, these proteins do not meet all the criteria of an intrinsic biomarker because their production is not constant and they present external clearance. They are affected by immunological, vitamin, and tumor disorders, among some other characteristics. For this reason, cystatin C, since it does not present this limitation, is the low molecular weight protein of greatest investigative interest in nowadays.
Different studies demonstrated that serum cystatin C is an important biomarker for diabetic nephropathy, or DN, finding out that the pool sensitivity for detecting DN with cystatin C was 0.88. Consequently, they identified cystatin C as a promising biomarker of renal failure and recommended as a way to follow up its levels regular lab tests considering the person's medical history. Besides, the authors included cystatin C in the group of proteins associated with renal damage and concluded that it could be used in clinical practice for early diagnosis of DN. This research contributes to the discipline due to it establishes reliable indicators of timely diagnosis that can be implemented in chronic care programs. It allows to develop preventive strategies in an appropriate way, and care can be directed to strengthen healthy lifestyle habits together with the adherence and effectiveness of pharmacological treatment. In addition, the research responds to the principle of opportunity established in the Law 266 of 1996, which ensures that nursing care should be provided when is requested or needed by people, families, and communities, in order, in this case, to prevent complications.
Finally, we systematically share science direct Cielo, Cochrane, Library, and Springer Nature between the months of August and November 2021 for experimental studies that include randomized controlled clinical trials and quasi-experimental studies and observational reports of sensitivity of biomarkers related to type 2 diabetes mellitus according to the 2020 PRISMA guidelines using the match terms type 2 diabetes mellitus, cystatin C biomarkers, early diagnosis, and renal insufficiency. Thank you.